Lake resident Joseph Jarvis started feeling sick just before Thanksgiving.
Headache first, just really exhausted.
He tested positive for COVID-19 and was in isolation for the holiday. A few days later, he was resuming normal activities, but then
Rebound COVID.
a public health consultant, Jarvis, is acutely aware of the dangers of this tripledemic.
My mother had COVID and almost died. These are not viruses to mess around with.
Our ICUs are pretty full. We're having to double bunk patients.
Dr. Per Gesteland is a pediatric hospitalist with University of Utah Health and Intermountain Primary Children's Hospital. He says hospitals around the state are experiencing high volumes of sick patients, which goes to show that these viruses don't pick and choose their victims.
The healthy, the frail, we can all get it.
While there are helpful preventative measures like washing hands and keeping your distance when you're sick,
Masks go a long way to prevent the spread.
Dr. Gesteland says vaccination is really the best form of protection.
Vaccines have been studied extensively and are effective and safe. And if we all got on board and got immunized, we could make a big dent in this big burden of disease that's affecting our community right now.
While these shots don't guarantee immunity from illness, they do significantly decrease the risk of serious illness or death. Which is why Jarvis believes his bouts of COVID were survivable.
I wouldn't be taking these vaccines if I thought they were a risk. But the upside to vaccines are so big and so great. To not give them to your children, to not take advantage of them for yourself, that's just foolish in my opinion.
And though there's no cure for this tripledemic, Dr. Gesteland says we can help slow the spread by working together.
The collective humanity that we have can make a difference by changing their behaviors.
For Your Life, Your Health, Emma Benson, KSL 5 News.